All right, short video here to just go over this 12-lead EKG reference that we've put together. So this first page on the document is just an overview of all the different steps that it walks us through. So basically just takes us from identifying that we want to perform a 12-lead and walks us through all the different steps we might need to perform along the way. So we'll get into the details in just a moment, but just wanted to show you how it's all laid out from the get-go. Now the goals of this document, the first one is just to compile all the different miscellaneous EKG and 12-lead interpretation references that we've come across in the last few years. So we've had just a bunch of notes on our phone and tabs bookmarked in our browsers and that sort of thing, but we tried to put them all into one place. The other thing that we tried to do is answer a few pointed questions. So in here, when we're assessing on step 3, assessing for an MI, some of the questions that we specifically wanted to dig into, one is how to match these occlusive myocardial infarction or OMI patterns with the things that we've been taught. So in the STEMI paradigm, we've all been taught how to identify where ST elevations correlate to on the myocardium and then which vessels are affected. We wanted to do something similar for the different OMI patterns. And then also, both for the STEMI paradigm and for the OMI paradigm, once we identify those things, how do we need to change our treatment? Are there interventions that we need to perform or things we need to do differently once we identify these patterns? So that's the idea behind this document. So the first page is just an overview. There's a couple of resources mentioned here, and we'll talk about more of these along the way. But let's just take a look and see how it looks. So it starts out very basic, how to identify when we need to do a 12-lead. There's some risk stratification tools here. It also talks about assessing our rhythm in lead 2 before we dive into doing a 12-lead. So there are some things that we can identify immediately and address right away, even before we get into the 12-lead. So those are listed here. The next thing we got here, and I've opened it up in a window for us to take a look at, but it basically shows if we have identified that a patient is high risk for an MI, so they have concerning signs and symptoms like shortness of breath, diaphoresis, chest pain. It kind of outlines the risk of how likely they are to have an MI based on their initial presenting rhythm. So some of this might be intuitive, but I think it's worth focusing in on because we can quite quickly get caught up in doing a 12-lead when we don't need to, or being concerned about a finding that we don't really need to be concerned about. So for example, if you have VTAC or VFib, we probably don't need to be messing around with doing a 12-lead right now. We need to fix those things. If we have a patient who's presenting with signs and symptoms of chest pain or of a MI, and they have PVCs, this may be concerning if they're happening frequently or increasing in frequency, but if they're just baseline have a couple PVCs, we probably don't need to be that concerned. Anyways, that's what this initial chart here was set up to demonstrate. Moving on from there, it goes over placing your leads, assessing ST segments. That's all stuff that you probably already know, but it's good to have a backup. Let's say, for example, you want someone else on scene, like a first responder, to help you do a 12-lead. You can just open this up and show them the picture, and that directs them to where to put the leads on a patient. The next section here talks about ruling out STEMI mimics. So these are things that present with ST elevation but aren't actually indicative of a coronary artery occlusion. So there's a couple things here. One is this raised ST segment mnemonic, and you can actually click this link here and it opens up a full PDF document that goes into specifics on each one of these points. And then these bottom two are screenshots from 2 really good references. One is from a website called OMI Guide, which you can, again, click on the link and open up. The other one is from an app called the OMI Toolbox, and there are links here for you to download it if you feel inclined after this. But let's take a look at these real quick just to show you what they're all about. So the first one is this STEMI Mimics mnemonic. So this is the picture that we put in the document, but if you scroll down, there are detailed explanations for each and every one of these points. So if you see one of these things, let's say you see ST segment elevation, and you want to make sure it's not, or you want to see if you can attribute it to a cause other than an occlusion or an MI, this is a good place to start. So that's what this one's all about, and we don't have to go into all the details there. The other one here, this OMI Pocket Guide, again, this is a website, but you can also like set up a shortcut on your phone to use it as a progressive web app. But basically it has its own take on ST elevation that is not indicative or is a mimic of an occlusion MI. So if you click on any one of these, it kind of opens up into a more detailed explanation that gives you examples and links to studies and everything that everything you need to look further into these ideas. So that's the STEMI mimic section. The next bit here is about assessing for OMI patterns. So you're probably familiar with this idea. This is like kind of a new paradigm to replace what we're calling the STEMI paradigm. So OMI is for occlusive myocardial infarction, and it's a more specific way to identify if what we're seeing on our 12 lead is indicative of an occlusion in a coronary artery. So there are lots of different patterns that indicate OMI in different regions of the heart. So this image here is from like one of the most exhaustive references like this, but it's not totally all inclusive. So we've included a couple others as well. So let's say you have a patient who presents with signs and symptoms concerning for an MI. You don't see any of the traditional ST segment changes, but you're pretty sure they have something. You can use any of these resources to kind of like identify patterns that might indicate that your patient is having an actual heart attack. We don't have to get into the specifics here. There's lots of good content out there these days about the OMI paradigm and all of these different tools that you can use to assess for them. But we've just included some of them here, and we made a couple notes along the way just to help you along. So the next step is, once we've identified a concerning pattern, traditionally what we've done in the STEMI paradigm is we've correlated those ST segment changes to a specific geographic region on the heart. And then from there, we've correlated that with a culprit vessel, like which coronary artery is occluded. We haven't really been taught super well how to do that on the OMI side. So that's what this chart is all about. So it kind of shows here on the left the different OMI patterns that we might see. And then the next column in the middle here shows the blood supply that is affected by those patterns. And then the areas of the heart in the last column, the areas of the heart that are affected. So this kind of like takes this idea of identifying the geographic region and the culprit vessel and lays it on top of all these different OMI patterns. So that's what we've got there. The next two charts here, these are big ones, so we'll zoom in on each of these. The first one here just kind of takes this STEMI paradigm set of patterns that we've been looking at and adds some columns over on the right. So we identify the area affected, we identify the blood supply, and then we identify what other structures might be affected. And then based on that, we can adjust our treatment as necessary and then look out for possible complications. Okay, let's work through one specific example here just to show you the idea that we're trying to get at here. So let's say we have ST segment changes indicative of an infarct on the lateral wall. So we're on the second row here. Most likely vessel affected would be our left circumflex and then other branches of the LAD. Other structures that might be affected would be the left atrium, the papillary muscles, and then the conduction system in general. Things we might want to do different in our treatment would be to consider listening to heart tones. Now, we don't routinely listen to heart tones in the pre-hospital setting or even with our MI patients in the field, but with a lateral wall MI, you could potentially have papillary muscle rupture and mitral regurgitation. So this might be one of those situations where like maybe we do need to take a moment and give a listen. So that is just a quick example of how we might change our treatments based on anticipated complications. We've done something similar for the OMI pattern. So as an example here, let's go down here to the, let's say we have this terminal QRS distortion in V2 and V3. So this is indicative of an LAD occlusion. So it'll affect the anterior wall. Other structures that might be affected would be the conduction system in general and the papillary muscles. So we might want to use caution if we have to give fluids. And then things we want to look out for would be LV dysfunction, cardiogenic shock, heart failure with pulmonary edema, LV thrombus, and then ventricular arrhythmias. So that's kind of how you can use these two charts to direct your treatments as you work through these things. All right, so let's go back to the document here. So that's what these giant charts are. And then because this one here is a lot of information on one page, we took out a couple columns here, and just this one is the same information, but we removed the affected arteries and the geographic region, and we just show the pattern seen, and then the structure, we just took out some columns there to make it easier for you to see. Other things we have on our guide here is if you had to do a right-sided or a posterior view, kind of walks you through how to do those. We also have some other things you might see on your 12 lead just for reference. So these are some patterns that could predispose a patient to having a lethal dysrhythmia, VTAC or VFib. We got a little quick reference on bundled branch blocks, axis deviation, as well as things that axis deviation in any particular direction might indicate. Same thing with R-wave progression, hypertrophy, strain patterns, that sort of thing. And then at the bottom, we just have a bunch of references for all the things that we sorted through to make this. So that's what this is all about. This is, I guess we'd call it our first draft of this, our first go around of kind of putting everything together into one comprehensive document. So there's a good chance there are mistakes or typos along the way. So if you see anything, get in touch. You can follow the link to our website and check us out there. Let us know what you think about it, and we'll follow up one of these days with another version.